Welcome to the next session of She Writes Live from Women Deliver Conference 2026 on the theme Sexual and Reproductive Health Rights and Justice in Cook Islands. She Writes Live at the Women Deliver Conference 2026 sessions are being hosted at D03 Exhibition Space in Narrm, Melbourne, Australia. All sessions are hybrid, live streamed, and host online and on-site speakers and participants, including media. She Writes is co-hosted by Global Center for Health Diplomacy and Inclusion, SEHDI, and CNS, with partners like CIFWA or Cook Islands Family Welfare Association, Women Deliver Conference 2026, International Planned Parenthood Federation IPPF, Asian Pacific Resource and Research Center for Women Arrow, Asia Pacific Media Alliance for Health, Gender and Development Justice APCAT Media, and Health TV Online Nepal. Our special thanks to Cook Islands Family Welfare Association or CIFWA for helping put this session together with all panelists from the Pacific region. A very warm welcome to Rongo File, Executive Director, Cook Islands Family Welfare Association. Welcome also to Hereiti File, Youth Advocate and Secretary, Cook Islands National Youth Council, and Women Deliver Young Leaders Alumni 2020 Cohort. Welcome to Jacqui, Program Coordinator and Sexual and Gender-Based Violence Focal Point, CIFWA. Welcome also to Tamara File, who runs CSE programs and volunteers for CIFWA for 17 plus years.
Hello, Kiara, Rongo, how are you? Thank you so much for CIFWA. So please go ahead. Let us have an introductory opening remarks from Rongo File. She has been a leader in this space, and especially for not only for CIFWA, but also, as Shobha rightly mentioned, has helped Cook Islands progress towards sexual and reproductive health rights and justice. So Rongo, over to you. Thank you.
Thank you very much. Thank you, Shobha. Kia ora, everybody. Kia ora, colleagues listening in this morning. We're quite very appreciative of the opportunity for CIFWA to be able to have this dialogue and conversation with you. First of all, of course, I've been introduced as Rongo File. I would just like to just say a few words on the organisation itself, although it's been mentioned previously. We are the Cook Islands Family Planning Association, and as a member, we are a member of IPPF as well, and one of the 10 member associations in the Pacific Island. The organisation was actually set up in 1987, and it became a full member of IPPF in 2014, which was quite a rigorous procedure in terms of trying to be accredited and become a full member of IPPF. CIFWA has been striving to meet sexual and reproductive health and rights of the needs of the community, in particular for us, for women, and it serves in improving access to sexual reproductive health and rights, and that is also inclusive of our information, our education around CSE as well. And our the activities that we deliver, the service that we deliver have also expanded over the period since 1987. So we're quite pleased to be able to be supported by our donors, which is DFAT, Australia and New Zealand, and IPPF, as well as various other donors that we are having the partnership with or being engaged with. Just to mention also that most of you probably won't know where or haven't a clue where the Cook Islands is. It has a population of 17,000, local residents roughly around 11,000, and we do average, or we have been averaging around 100,000 visitors per month, which is quite a lot. And when you think of the impact it has with its environment and socially, that does become an impact on the Cook Islands as well as the people of the Cook Islands. So I guess I will stop there, but I would like to go back and acknowledge the opportunity, of course, as I mentioned before, opportunity given to us to be able to present to you this morning. Thank you. Thank you, Marta.
Thank you so much, Rongo. Really grateful to hear you, especially as the Women Deliver is yet to open, and so we really look forward. Now, I would like to invite, as Shobha had already introduced, another colleague from Cook Islands, Tamara File. Tamara, as Shobha mentioned, has been working on volunteering for over 17 years for Cook Islands Family Welfare Association, running the comprehensive sexuality education program, conducting outreach and advocacy, and creating comprehensive sexuality education resources. She has also contributed towards gender-based violence earlier as president for Hunananga Tauturu Women's Counseling Center. Forgive me if I'm not pronouncing it correctly. And of course, earlier has really worked a lot on youth empowerment. A lot of contribution. Tamara, over to you.
Thank you, and kia orana. You did quite well pronouncing those words, by the way. Yes, so I'm Tamara, and I'm going to be talking a little bit about the comprehensive sexuality education program we have in the Cook Islands. It's kind of my area of expertise, even though I feel a bit like an imposter when I say that, because it's not something that I studied or anything, it's something I kind of fell into. So it was mentioned that I've been doing this for about 17 years, same age as my son, because he was just little when we started. I came into the organization and they didn't have any youth program at the time. And I was young then, I'm not as young now, but at that time I was a bit younger and I was working in the youth space. And so when I noticed that there was no youth program at the organization, we decided that it would be a good idea to put something together. And we were kind of trying to figure out what that looked like. So what we did was we got a bunch of young people who had represented the Cook Islands at IPPF conferences, and we asked them to come in on board and just form a youth group that would then go and talk to other young people and sort of try and relate to them and talk about sexual reproductive health and rights. And sort of along the way, we realized there wasn't a lot of education happening. When we thought about what we were learning in our schools, we weren't learning anything. We have an extremely religious Christian society in our country. And so talking about things like sex and pregnancy and body parts and all of that stuff is kind of taboo. So we couldn't really speak openly about it. And so we decided that that was sort of going to be our mission. As a group of young people, we were going to make sure that other young people got to hear what they needed to hear. And then we took at the time, IPPF had their It's All One curriculum come out. And so we had a look at that and we sort of took it and developed a program that would work in our context. And we started trying to get into the schools and into the communities doing comprehensive sexuality education. And we had a lot of pushback in the beginning because, like I said, it was taboo, not something really talked about. So we kind of, I want to say forced our way in, but we did definitely push and basically keep hounding the school, the Ministry of Education, the different community leaders. And eventually they started allowing us to go in, but they only allowed us to talk about things like self-esteem, decision-making, those sorts of things. And so we started with that. We're like, we'll just get in any way that we can. And once we started doing that, there was a bit of trust building happening. And then over time, we found that they started seeking us out rather than us trying to push our way in. And they started allowing us to actually talk about STIs, about protection, about pregnancy, hormones, like all the things that you weren't allowed to talk about before. They were actually asking us to come and do it. At the same time, we started running a radio program where we would once a week get on the radio and actually talk about all of that stuff. And so I think that was helping the community to open up to the idea of it. I used to get people stop me in the street and actually say to me, oh, they loved hearing us talk about that on the radio, and actually wish that that had happened in their time when they were young, that people were talking about these things, and they feel like they would have had a different outcome in life if maybe they'd learned these things early on. So it kind of reinforced the importance of what we were doing. And so where we are today is that we have a program that is running all over the island. Everybody knows we do it. The schools contact us same time every year saying, come on in. We're going to organize a bunch of sessions. We're also going into private schools. There's a private Catholic school that we've done. We've also done the Seventh-day Adventist private school, and then a private primary school on the island, as well as doing the national college. So we've come a long way over the last 16 years. We're actually allowed to do what we do. Nobody bats an eye. I'm saying a lot, but like, so what we've found is that it's become a lot more normalized, and everybody just knows that that's what we're going to talk about. The kids are going to learn it. The kids are empowered. Because of the program, you also see a lot of young girls accessing the services, even boys coming in for STI testing. It's become a lot more normalized, and the access to condoms has increased as well with young people. So we can see the results, and it's definitely something we're very proud of. And what we're looking at now is how do we take that into the next kind of movement with technology. So over the past few years, we've been trying to develop more materials that are online focused. And we're currently working on having a mobile app for our organization. And we're hoping to launch that this year. Very excited about it, so that young people can actually access it on their phones from their devices. And we can capture those that we're missing when we go into the school settings or into the communities. So I feel like over the last 16 years, we've made a lot of progress, and I'm really excited to see what we're going to be doing next. Thank you.
Thank you so much, Tamara. Really important to know about the journey of advancing such an important work in Cook Islands. So moving forward, we will today not be able to hear Hereiti File as perhaps she is in the youth space. However, let us move forward to listen to Jacqui. Jacqui, welcome. Jacqui is also from Cook Islands and has been in other Pacific countries as well and regions. Jacqui took up volunteering with Cook Islands Family Welfare Association at the age of 20 and has been an active member of Cook Islands Family Welfare Association every time she's in Cook Islands. And let us hear more from Jacqui. Jacqui, welcome. Over to you.
Yes, kia ora nā tātou katoa toa. I te popongi translates to kia ora nā everyone and good morning. Thank you for the privilege to come on board and just speak about some very important topics that are prevalent to our society, not only in the Cook Islands, but everywhere else in the Pacific. So as mentioned, my name is Jacqui. I am the program coordinator, the current coordinator for Cook Islands Family Welfare Association. I first came on board with Cook Islands Family Welfare as a volunteer. I was asked to attend a Winds of Change training in Fiji, and that's when I became aware of the organization and the work they were doing. I have been volunteering with CIFWA on and off since the age of 20. I won't tell you how old I am now, but I'm not 20 anymore. So it's been a very eye-opening experience for me, starting off as a young person. And as a young person, you know, you're dealing with identity crisis. You're dealing with sense of belonging and everything. And to be privileged to be part of an organization where I could find myself, it was a great experience to be. And I had the privilege of working with Tamara and Rongo in establishing the youth group, and one of the first young people to also advocate at the schools, and taking the topics of CSE to the schools that we were able to get to, the uniform organizations from different church denominations on the island, and to our Pāinua. When we say Pāinua, we're talking about the other islands other than the main island of Rarotonga. So in case you don't know, we are made up of 15 islands, of which I think 11 of these islands are populated. And while we cannot go up to the furthest islands because of costs, we are able to go to our neighboring islands to the main island. And it's been an experience, it's been a journey, and it's been a great one, learning more and more from not only my peers, but also like-minded people, seeing the winds of change within our communities, and seeing the mindsets of our older generation also, I wouldn't say changing altogether, but becoming more aware. And currently what we are experiencing is, as a program and SGBV focal point of the family welfare, I've also become more aware of SGBV in the Cook Islands. I wasn't really aware of SGBV in the Cook Islands until I was later on in my 20s, when I realized just how prevalent SGBV is in the Cook Islands. And although I've had some personal experience with SGBV, I still didn't understand that it was SGBV. And just looking at the studies that have, that has come through with our partners, such as Te Maraeora, which is our Ministry of Health, they've put together surveys from 2014 where we had 1 in 10 women had experienced some form of violence. And then 4 years later, we had 1 in 3 women had experienced physical violence of some sort. So it makes me wonder, and that's just the reported ones, just makes me wonder just how much more people are out there that are experiencing SGBV and not aware of it. Just like I wasn't aware that there was SGBV until I was in my late 20s. It's the Cook Islands has come a long way in terms of reporting, and with SGBV in the Cook Islands, it's very much a patriarchal country. We are very stemmed into the Christian faith, as Tamara said, into the Christian faith. Everything is patriarchal. Everything is the traditions and the culture of our people are all based on patriarchal customs. And so we have there's that mindset of women are to be seen and not heard, and women are to obey their husbands or their partners without question. And just recently, looking at some figures, we had 759 out of the 17,000+ people of the Cook Islands were interviewed, and over 39% of women have said that they have had physical violence. And then we also have another 52% who've said they've had sexual violence. And again, this is all reported. What about the women that are not being reported? Because we have that mindset of this is our business. Nobody should know our business. I can talk to my friends about it, but I will not report it to the police. Because once it gets to the police have a no drop policy. And once you report it, they will take it through to court. No matter how many times you go back to try and retrieve your report, the police will not be able to do so. So a lot of learning curves in my journey with family welfare, and a lot of learning curves as well. And living in the Cook Islands, I get so blinded by what is going on around me that it's only when I am part of an organization such as this, then I realize there's more to it than what I actually see. So yeah, that is me for now. If you have any other questions then further on into the session, I'm more than happy to answer. Thank you.
Thank you so much, Jacqui. Very, very important work again. All power to you, to keep making change and spreading light. So now let us move back to Rongo File. She, as you all know, she's the executive director of Cook Islands Family Welfare Association. And Rongo is going to speak about cervical cancer, and which is a very important subject, because cervical cancer, perhaps Rongo, please correct me if I'm wrong, is the only vaccine preventable cancer. We have HP, very effective vaccines against one of the most prevalent and cancer-causing strains of HPV virus. These vaccines have proven to protect people from HPV-related cancers, including cervical cancer. We have very highly sensitive screening tools today, like molecular tests, WHO-approved molecular tests. But I come from India. We are using less sensitive tests to test women for cervical cancer, such as visual inspection by acetic acid or Pap smear. We can do so much more better. Let us hear more about from Rongo, but I would like to remind everyone that Australia has shown that it is possible to bring cervical cancer almost to elimination levels, or very, very low rates. If we do well with vaccination, screening people, linkage to care, we can do so much more better. No women should be, dying or suffering because of a vaccine preventable cancer, a cancer which we can screen and diagnose even at the pre-cancer level and save lives. So over to you, Rongo. Thank you so much for helping put this session together. This is being hosted by CIFWA and partners. Let us listen more from Rongo. Over to you.
Farana again. Thank you for having me back on. And you're quite right. You're very right about preventable. Early detection is very important. So we do try and run some campaigns and promotion around trying to encourage women to come forward. And it's one of the most difficult promotion that we go through to try and engage women. And there's always that reluctant, or we say barriers. I would like to talk about the cervical screening program we've had since 2024. In more of an expanded way, because there is the lack of access as well from the Northern Group and Southern Group Islands. They're more difficult to reach, more costly to reach to the women, although the population is a little bit less. But we do have these challenges where our nurses is not so engaging with our community. It's too small of a community. They do not want to go to the hospital to get their Pap smear because they're related to either the nurse or the clinician who's actually providing that. So they would prefer a doctor or a nurse or midwife from Rarotonga to come into their setting to carry out those work. So hence we actually would prefer to provide a team that would go to either the Northern Group Islands, which is further away, or the most distant islands in Cook Islands, and the most costly as well. We've been fortunate with the big support from Australia in the last few years to enable us to take a team of clinicians to the Northern Group to actually provide these services. We are fortunate as well to be able to take another team of clinicians. This is in working in partnership with the Ministry of Health, as well as our community groups who are able to assist in ensuring that we actually reach a lot more women in these Northern Group Islands and Southern Group Islands as well, the 5 islands in Southern Group Islands. Rarotonga is the most populated, so there's always that challenge where the women in Rarotonga would prefer maybe to go to Australia or New Zealand to access cervical cancer. But we are able to run those campaigns currently where we can go take the service out into the community, and rather than waiting for women to actually present themselves at our clinic. The opportunities to have access is one of the key areas or issues that we have. The testing, we have a lot of difficulties with the length of time where the tests are sent to Australia, to the lab. The turnaround is very long, very lengthy. So we felt that perhaps we should actually engage in technical assistance from Australia and New Zealand to enable us to provide those testing in country. And that would actually build a lot more engagement from the women if they know that when they come and get their pap smear done at the clinic, the testing will probably be 1 or 2 weeks rather than all on the spot as well. And that's another activity that would be introduced soon to the Cook Islands for the testing. The resourcing, the technical expertise, where we actually require to train our nurses and doctors to have the skills to be able to provide the services as well. So currently, usually there is a team that actually visits Cook Islands or Rarotonga within the year or 2 years' time, where they could actually provide expanded services. As well, we do reach out to donors for funds to actually enable us to provide the HPV vaccine. And this is to the 9 to 11-year-olds in the schools, but that hasn't happened for quite a while. But we are actually in the process, or the Ministry of Health is, and as well as the support from CIFWA, from our organisation, to run those campaigns. And hopefully this year we should be able to engage the schools in providing those services. And with the backing of, a bigger, wider information that goes out to parents as well. So in all, this has been quite a successful program. We actually just launched the starting of the cervical this year, and it was hosted by the community, one of our chiefs in the community, who offered her palace where we can actually run and provide that services to. A few days before we actually came to Women Deliver, we were able to provide the service in the community, do the advertising, as well as have our representative, our Excellency High Commission from Australia, who was able to speak to the women, as well as encourage the women to actually come forward when we actually present in their community or in our own setting as well, just to encourage them to take the opportunity to be picked up. And the figures that actually showed last year, there was quite a few referrals to New Zealand for those who were detected with either breast cancer or cervical cancer. So we're quite fortunate in terms of the support that we actually being continued from Australia. And I believe with New Zealand, that will be a big project that will be happening this year in the Cook Islands. So, yeah, so thank you for that.
Thank you so much, Rongo. Very important another very important piece of work for CIFWA to help save lives from cervical cancer. And I'm very sure that with the champions like you, the change will be significant and a learning lesson for many other countries to further improve their cervical cancer response. And of course, other initiatives which you are so importantly carrying on for gender justice in Cook Islands. So friends, see, you can perhaps get more information on Cook Islands Family Welfare Association from their leaders, who some of them spoke at this session today. They are here at the Women Deliver Conference 2026, and we are also sharing a booth. The booth number is D03, and the gates open at 3:30 p.m. on 27 April, which is today. And so please be welcome to drop in there or contact CIFWA or Rongo File and her team of champions in the conference. So thanks a lot, Rongo. Thanks a lot, Tamara, Jacqui. All power to you. Have a very great conference, and really look forward to hearing more from you all. Thank you. Thank you so much. Bye-bye. We will not take any questions, Rongo, as this session will again be streamed in the exhibition space. However, we are sharing the live stream with the media, and we'll keep you in touch with as the coverage happens. Thanks a lot. Thank you so much, and best of Women Deliver conference experience to you all. Thank you. Bye-bye.